Dr. Ronald Baldessari is at the 2015 Conference on Retroviruses and Opportunistic Infections, where he spoke with Dr. Jonathan Mermin, Director of CDC's National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention.
So, Jono, you know that one of the major issues being discussed here is pre-exposure prophylaxis at CROI. What are we hearing that's new about pre-exposure prophylaxis for HIV infection?
The research presented at the conference continued to support the power of PrEP to prevent HIV infections. And increasingly, we are seeing that the challenge is how do we help people take daily PrEP in sometimes difficult circumstances regularly so that they can get maximum effect from the medication. But in these studies, they show that it can work, and it can work well if people take it regularly, whether they're gay and bisexual men, heterosexual men and women, or injection drug users.
So switching gears, Jono, you and several colleagues from CDC published a very important paper recently in the Journal of the American Medical Association related to where we are as a nation in achieving the goals of the National HIV/AIDS Strategy, particularly in terms of reducing new infections. Can you tell our viewers what the headlines were from that analysis?
Yes, so as you know, Ron, increasingly in the United States and worldwide, we've been looking at the continuum of care for people with HIV, where the ultimate measure of success is suppressing the amount of virus in a person's body. And that is an excellent marker of good quality care. Mm-hmm. But from a prevention standpoint, we want to combine the risky behaviors, whether drug use or sexual behavior, with viral load to put them together to estimate what is the risk of transmission of HIV from people along the continuum of care. And that would help us look to where we should concentrate efforts if we want to make a difference from the prevention standpoint. So colleagues at Emory and at CDC developed a model that combined both sexual and drug use risk behavior and data on viral suppression looking along the continuum. And what we found was that over 90% of transmissions of HIV in the United States are coming from people who either have HIV and don't know it, or know they have HIV but are not receiving regular HIV medical care. And what that tells me is that we have an enormous opportunity as a nation, that if we can diagnose the close to 200,000 people who have HIV and don't know it, and help link them to care, and then help people who know that they have HIV overcome the obstacles that often prevent them from getting regular care, then we should shift the epidemic and could have a dramatic effect on reducing HIV incidence in the nation.
Great. Well, that's really important work, and we congratulate you and your colleagues at Emory University. It's been a pleasure speaking with you, Dr. Mermin, as always. This is Ron Baldessari signing off from CROI 2015.
For more information about the conference, visit www.croi2015.org. And for more information on federal HIV programs, visit AIDS.gov.